Could you please explain what are non-steroidal anti-inflammatory drugs?
The full name for NSAID is non-steroidal anti-inflammatory drug. These kind of medicines are widely used to relieve pain, to reduce our inflammation, and as well as to bring down the high temperature. The most common NSAID that we can find widely in the market is aspirin.
What is the classification of such drugs, and do you have any examples?
There are two, which are the non-selective cyclooxygenase inhibitor and the selective cyclooxygenase 2 inhibitors. There are few categories for the non-selective cyclooxygenase inhibitors, which are the acetates, phenamates, oxychems, propionates, pyrazolone, and the salicylates. Example for acetates is diclofenac. Then for phenamates is mefenamic acid. For oxychems is the proxichem. For propionates is ibuprofen. For pyrazolones is the phenylbutazone. For salicylates is aspirin. The example for selective cyclooxygenase 2 inhibitors are the celecoxib and the meloxicam.
What are the clinical uses of those drugs?
Fever and inflammation reduction. It is considered to be a highly effective drug class for pain and inflammation. The analgesic, anti-inflammatory, and antiviral properties of the non-steroidal anti-inflammatory drug is useful for symptomatic relief of painful inflammatory condition and fever. So, they are also used to treat musculoskeletal injury such as chronic cases like osteoarthritis and rheumatoid arthritis, and also for acute cases like acute gout and injuries. In addition, the non-steroidal anti-inflammatory drugs are used to treat headaches, dental and post-operative discomfort, dysmenorrhea, and aspirin to avoid cardiovascular incident.
Do they have any adverse effect?
Yes, sure, but first let me explain to you the difference between adverse effect and side effect. Adverse effect and side effect are unintended response when given with normal dose of drug. Adverse effect is harmful, while side effect sometimes can be beneficial, sometimes can be harmful. Adverse effect is also unexpected, but side effect is expected and explicable. Moving on to the question, NSAID can cause serious gastrointestinal, cardiovascular, and also renal adverse effect. This drug inhibits prostaglandin synthesis, causing the GI mucosal barrier to collapse, leading to bleeding in gastrointestinal. Next, patient with congestive heart failure is at risk of disease compensation if prescribed with NSAID because it can lead to increase in blood pressure. Therefore, this cardiovascular adverse effect is associated with the use of NSAID in the treatment. Moving on, the renal adverse effect is actually rare, sometimes temporary, sometimes reversible, but the rate of adverse effect is increased in patients with diabetes, heart failure, renal dysfunction, and also in elderly. So that's all for adverse effect, while the example for side effect are stomach problem, heart attack, stroke, and also allergic reaction. So that's all for side effect and adverse effect.
Could you please describe the general pharmacokinetic properties of NSAIDs?
Now I'm going to briefly explain to you about the pharmacokinetic properties of NSAIDs. NSAIDs are easily absorbed in the stomach and also in small intestine, as they are weak organic acid in which they have pKa from the range 3 to 5. So pKa indicates the strength of acid. The lower the pKa, the higher the strength of acid, the more stable the conjugate base is. They're also highly bioavailability, which 95% of them are bound in the protein plasma, especially to albumin. They are hepatic metabolized by oxidation and conjugation, where it happens in the liver, in order to inactivate metabolites that are usually excreted in the urine or partially in the bile. NSAIDs can be divided into two groups depending on their half-life elimination, which is short half-life and also long half-life. So long half-life, the drugs are eliminated about or more than 12 hours, while short half-life will take about 6 or fewer. So for example, ibuprofen or diclofenac will take about 2 to 3 hours, and NSAIDs typically like oxycams have very long half-life, which is take about 20 to 60 hours. Deposition of NSAIDs involve the measurement of their concentration in synovial fluid. This is because they tend to accumulate in synovial fluid as the concentration is more stable in it compared to plasma. Other than that, higher concentration can contribute to prolonged effect in the short half-life, which are usually administered in the intervals longer than the half-life in plasma. As for long half-life, NSAIDs requires more time to reach steady-state plasma levels. With longer half-lives, the drug's concentration are able to equilibrate between the plasma and the synovial fluid.
What is the mechanism of action of NSAIDs?
Okay, so I am going to explain the mechanism of the anti-inflammatory drugs. So the main role of these drugs is actually to stop the inflammation response. Well, inflammation response is actually a normal response or a normal immune defense mechanism in our body, which is to fight disease or pathogens. But somehow, if we had a persistent inflammation or the inflammation occurs continuously, it can damage our cells, tissues and our cells body. And there will be a chemicals produced known as prostaglandins. So these prostaglandins is actually the one that cause our tissue to swell. So as we consume the drugs or the patient consume the drugs will stop or inhibit these two enzymes activity, which is cyclooxygenase 1 and cyclooxygenase 2. As for these two enzymes, the main role of these two enzymes is actually they are the one that stimulate the production of prostaglandins. But to mention about other purpose or other functions, for cyclooxygenase 1, the function is to regulate a normal physiological process or a normal homeostasis function in our body. And as for cyclooxygenase 2, it produces prostanoids during inflammation. So when we consume the drugs will stop these two enzymes activity, and then which is the production of prostaglandin also will be inhibited or will be stopped. So the tissue will be no longer swollen, and the patient or our body will no longer feel the pain. So that is the purpose of the anti-inflammatory drugs. And then they will be after that they will be metabolized to hepatic circulation, where they will be excreted through the urine and the bile, and somehow in some amount will be reabsorbed in the intestine for its function in our body. So actually that's all for the mechanism of the anti-inflammatory drugs. Thank you.
And lastly, could you please summarize what are NSAIDs and corticosteroids, and maybe what's the difference between those two?
So as a summary, it is believed that the anti-inflammatory and immunosuppressive effects of glucocorticoids depends on the ability of its receptor GR to inhibit the activity of transcriptional genes. Transcriptional regulators for pro-inflammatory genes, for example NF-κB and AP1 through a term called transcription. The binding of glucocorticoids to the receptor also activates gene transcription for anti-inflammatory and immunosuppressive actions. Also, glucocorticoids exhibit metabolic effects which require gene activation by GR, and the examples of these effects are like the stimulation of fat breakdown or even controlling and maintaining the balance of glucose concentration in blood. Moving on to NSAIDs, they mainly play a role in inhibiting inflammatory response and helps in analgesic actions like reducing the pain, and they are also very significant in fever reduction. And the similarity to all these effects is that they all require the decrease in secretion of prostaglandins for all of these effects to come to work. So that's all from me.